What's going on, everybody? My name is Dr. Eli, and welcome back to my YouTube channel. Some of you may know on my channel before I've had a dental school vlog playlist where I allow people from other dental schools in the United States to vlog a day in the life at their school. This is helpful for all the subscribers on my channel because a lot of the pre-dents that follow me want to know about dental school, but they may not necessarily want to go to the school I attended, which is Boston University. So in today's video, I have Tasie here showing you all a day in the life at the University of Pittsburgh. Tasie is a longtime subscriber of my channel, and she actually volunteered to do this video before she even started attending Pitt. Tasie's in a very unique position because she did a combined BS D.M.D program at University of Pittsburgh. So when she chose to go to college at the University of Pittsburgh, she was also basically given a conditional acceptance into the dental school, provided that she meets certain criteria as an undergraduate student at the University of Pittsburgh. If you are a high schooler, that's a very interesting lane that you can take that kind of guarantees your way into dental school. And it's a very nice program for people that already know what they want to do coming straight out of high school. I've heard of this before in other medical and dental fields where you can do combined programs where it's 3 years of undergrad and 4 years of professional school, or sometimes even 2 + 4. Anyway, I don't want to make this intro very long. Tasie, thank you so much for doing this video, and I hope you all enjoy watching a day in the life at the University of Pittsburgh. Now let's go and watch the video.
Good morning, everyone. My name is Tasie, and I am a D1 at the University of Pittsburgh School of Dental Medicine, and I'm happy to be bringing you guys along on a day in my life today. I have a pretty busy schedule. I have cardiology lab and lecture, and then in the afternoon I also have head and neck lab and lecture. So we'll be getting ready for our lab practical in cardiology, which is upcoming. So I believe we're doing 2 MODOs and filling it, but I could be wrong. So I'll double check that and get back to you guys. To give you guys some background on me, I'm originally from Boston, Massachusetts. Well, outside Boston, Massachusetts, and I was born and raised there. I went to undergrad at Pitt, so I'm familiar with the area. When I was in high school and I was applying to colleges, I kept my eye on combined degree like BS D.M.D programs, and I was fortunate enough to get accepted into the one here at Pitt. So that's a bit more about my process into how I got into Pitt Dental. So usually with that program, it might have changed since I was a freshman in undergrad, but when it was time for us to matriculate, we had to make sure that we had a certain GPA. We had to interview and then also send over our transcripts and stuff like that with a recommendation letter. So if there are any high school students out there who already know that, dentistry is something that you want to do, I would definitely recommend looking into those type of programs just because I feel like it was a great opportunity. And I'm really happy that I ended up staying and going to Pitt Dental. So yeah, I do have a couple of side quests today. This morning, I'm gonna go and get breakfast and probably get a coffee with some of my friends at this bagel spot. It is pretty early, I'm not gonna lie. It's 5:35 because we have class at 8 a.m. but I really want breakfast, so I'm going. And then in the afternoon during lunchtime, I have a meeting with student affairs or admissions and SNDA because we're preparing for an upcoming Impressions Day. Make sure you check out our Instagram, SNDA at Pitt. I'm pretty sure, yeah, SNDA at Pitt for more information. And then in the afternoon, after lab around 7:30, I'm gonna catch a movie with some friends. So I'm excited for that. This week is a pretty chill week because we don't have any major exams or anything. We just came off of a very heavy exam week and practical week. So these next 2 weeks before finals is a bit chiller. So yeah, I will check in with you guys and let you guys know how breakfast goes. I don't remember the spot of it, or the name of the spot, so I'll find out and tell you guys. Okay guys, so we just got our food and our coffee. We all got the same breakfast bagel. What did we get, Rose? Because I can never say the name.
We got the spicy.
Right. And I think it has like bagel. It's on a bagel with egg. What else?
Eggs,
Cheese.
Bang sauce.
Yes.
And Greek.
Yes.
And like the meat or whatever.
Yeah. And for my drink, I got a raspberry cookie shaken espresso.
I got a cheesecake cookie butter shaken espresso.
I got a strawberry shortcake matcha. I got a banana pudding.
I got a snickerdoodle bug. Goldman, I don't know.
And it's very good. So if you guys are ever in Pittsburgh, curbside on the run.
We're like influencers.
So it's currently 7:37 and we made it back to school. We're probably gonna sit in our atrium and just finish our breakfast, have some coffee, and probably set up for lab. So we just got out of lecture. Our lecture was on, this is Nadia, my friend, and my mod buddy.
Yes.
She's right before me, right?
Yes.
Yeah, in our little like system. But yeah, our lecture today was on amalgam. So we talked about like pros, cons, and like what the current literature is saying.
Yeah, and like why we don't really use it anymore.
Exactly. So in cardiology lab today, we're doing a MOD,
DO.
and a DO.
Yes.
Yes. I haven't looked at the syllabus yet. Good morning. Okay, so we just made it over to the med school. So it's super close. It's like across the street. So we just come over here when we're doing head and neck dissection. Hopefully we get out soon.
I think today's about to be rough, but
Yeah.
it's okay.
And it's already been a long day, so let's see what time we get
for
out.
us.
So I'm finally back home. It's currently 4:58, and that's typically the time I'll come home around if I had lab that day. So what our school usually does is we're divided into groups, like 1 through 12. So like the first 6 groups will go into lab at the same time, and then groups 7 through 12 will be in lab at the same time. So last week I went on, or my section went on Friday. So today's Wednesday. So it was our day to go into lab today. We usually only have that lab, or we only have that lab Wednesdays or Fridays, depending on, like, we just alternate. So yeah, that's a bit more about like the breakdown. What else was there? For cardiology lab, usually it's just like all of us that are in there at the same time. So yeah, that's usually what my Wednesdays and Fridays look like. The rest of the week, I don't really have any labs outside of that. We had a perio lab where we would do like probing and exploring, but we just took our competency exam. So yeah, that class is over. We are getting really close to finals week, so I have to start preparing for that. Like I was saying before, whenever we have like off weeks, it never really feels like an off week because you're just like mentally preparing and like physically preparing for finals week and like upcoming exams and stuff. So now that I'm out of lab, I'll probably like just get some cleaning done and study a little bit before I go to the movies with my friends. The movie's showing at 7:30, so I have a couple hours. I have about like 2 realistically, so hopefully I'm able to get a lot done. And yeah, I'll check back in with you guys later. So before I go, I did want to talk about a few of the things that have been highlights or things that I look forward to that are sort of embedded into our curriculum/program. So for my highlight so far, since D1 fall, because we're currently in the spring semester, so since the fall, we've been able to have clinical rotations in our modules and in our screening clinic. So basically for our clinical modules, when we have rotations in there, we're assisting the D3s and the D4s. And it's nice because you're able to take a break from like having classes all the time, and you sort of remember again, you know, why I wanted to be in dentistry in the first place, because I feel like you can sort of forget when you're just like in a classroom learning all the time. But yeah, that's enjoyable. And it's also good because you sort of get to know your way around clinic before you even get down there. You get to interact with patients and all of that. And then for our screening clinic, it's very similar, but we're not really assisting. It's more of a shadowing experience because in that, in the screening clinic, the upperclassmen will basically just do a head and neck exam and take patient history of any incoming patients that are wanting to be seen at the dental clinic. So yeah, in that way, you're also able to just get to know your way around and ask questions if you have, make connections with our upperclassmen as well. And yeah, that's been the highlight so far. And the other thing I was going to talk about, what was it? Oh, the thing that I'm looking forward to is being able to do my capstone project for the dental public health certificate that I applied for. So with our school, you're able to obtain the certificate, and basically the capstone project consists of you either creating or participating in helping with a current community health initiative. And that's a sector that I anticipate myself either working in after graduation or volunteering in. So it particularly piqued my interest. And it's good because you're able to sort of gain exposure, one, and sort of step foot and learn more about, dental public health as a field before you even graduate. So it's a great opportunity. And I thoroughly enjoy it. I look forward to it. We start taking classes for it pretty soon. Our D2 year, D2, D3 year. So yeah, D1 year, you basically, our instructor just wants you to focus, on the classes, get acquainted, and you dive into those classes later on. So that's something to look forward, that I'm looking forward to particularly. I don't think there's anything else I wanted to talk about. Yeah. Hey, so I just got out the shower and now I'm just getting some things done before it's time for me to head out and meet my friends to go to the movies tonight. Right now I'm working on some stuff for SNDA because, like I said before, we are planning an Impressions Day event. If you're seeing this before the 22nd of May, it is not too late to sign up because our event is on May 30th. So go to SNDA at Pitt on Instagram in order to sign up. We'll have a lot of fun things. We have an admissions talk that's going to happen with some financial aid information. We're going to have a hands-on activity, so we'll be taking impressions. We'll have mock interviews, a student tour, all the good things that you're going to need. So yeah, I'm just working on that right now, and hopefully I will probably be able to start studying or just look through some stuff before it's time for me to go. I have about 30 minutes before, so let's see. I'm just gonna try to use my time wisely. It's what I do these days. But yeah, I'll check in with you guys probably once I meet up with my friends. Just got dinner at Taco Bell. Rose, you're not in it. Okay, we're gonna head over to the movie now. I got a Crunchwrap Supreme and the cinnamon twist. Hey, so I'm finally back home for the night. It is past midnight. That movie was a bit long, but I'm glad that, some people from class were able to join us. I think there was 13 of us or 12 of us. So that was nice. I did have a lot more side quests today than normal, but I hope that you guys enjoyed watching as much as I enjoyed filming it. I hope that you guys got to, see more about Pitt Dental and Pittsburgh as a city. And yeah, thank you to Dr. Eli for giving me this opportunity to show you guys what a almost typical day in my life looks like. And make sure you subscribe to his YouTube channel. I've been locked in since 2020, so you guys should get on that. And follow me on Instagram, tasie.asiabanam. And yeah, thanks for watching. I hope you guys enjoyed. Bye.